Tonight we had another successful town hall meeting in which we engaged the community regarding the vaccination rollout in St. Kitts and Nevis. As of this afternoon, we had just under 6,000 persons who have been vaccinated. That brings us close to 18% of our target population, which we need to have vaccinated to achieve herd immunity. Tonight's session was to bring the information to the people in a manner in which they have the opportunity to share their concerns, to express their fears, and to have them answered by the professional and the experts in the health ministry. I want to commend our Medical Chief of Staff, Dr. Cameron Wilkinson, our Permanent Secretary in Health, Dr. Dolores Stapleton Harris, and of course the District Medical Doctor, Dr. Bernice Nisbet, for participating in this very rich experience for the people of the community of St. Paul's and the adjoining areas. I think this has been highly successful. We had a sense of joy. We, at the end of the question and answer period, a number of persons moved forward to have their vaccination. That tells me that it was very persuasive, it was impactful, and it has helped. And I know these persons are going to be ambassadors. They're going to be out there with their own experience, sharing with others, and as a consequence, we're going to have more persons participating in the program.
I will take the vaccine because building defenses against COVID-19 is a team effort, and we are all a key part of that defense.
I definitely will be taking the vaccine when it's my turn.
I will be taking the vaccine as it is an important tool in the fight against the pandemic.
It is important for me to vaccinate to ensure that if I do become infected with the disease, it can prevent hospitalization. In addition, it also helps with herd immunity.
I will take the vaccine to protect myself, my loved ones, my clients, my co-workers, my community.
St. Kitts and Nevis, why do we need to vaccinate? Kenisha? So we can jab COVID-19 away.
You know, it's me, Mr. A.
Is on.
Good day and welcome to another National Emergency Operations Center COVID-19 weekly briefing for Wednesday, the 26th day of May, 2021. I am Les Roy Williams. Thank you very much for joining us again for our press briefing. We continue to update you with the latest information with respect to the management of the COVID-19 pandemic in the Federation of St. Kitts and Nevis. Of course, the pandemic is still with us, and we have to manage it as best as we could. So thank you very much for the role that you play in keeping the Federation of St. Kitts and Nevis safe. And thank you very much for being attentive to these press briefings. We are here to serve you. It has become known that persons in the Federation who have contracted the COVID-19 virus or are suspected of having contracted the COVID-19 virus, there are people who are attacking, making certain unsavory comments towards them, discriminating, and so on. This is absolutely wrong, and it really should not take place. Anyone can contract the virus, as the virus does not discriminate. So therefore, we must not get involved in discrimination of persons. I invite first to the podium the Chief Medical Officer, Dr. Hazel Laws, who again will present us with the Health Emergency Operations Center report.
Thank you, Mr. Williams, and good afternoon to everyone. This afternoon, I will provide you the HEOC situation report as per usual. Okay, so over the past 24 hours, we have identified 3 additional confirmed cases of COVID-19. So at present, we now have a total of 64 confirmed cases of COVID-19 being reported by the Federation of St. Kitts and Nevis. As you can see, 50 St. Kitts, 14 Nevis. 45 of these cases have recovered fully, and at present, we are monitoring 9 active cases. Please note that the 3 additional cases are linked to previous cases. Health practitioners across the globe have been monitoring this COVID-19 pandemic. We've been responding to this COVID-19 pandemic. And to date, 167.5 million persons have been confirmed with this disease, and 3.5 million deaths have been reported. Concurrently, territories across the globe, they have started their COVID-19 vaccine rollouts, and to date, 1.5 billion vaccine doses have been administered. In the United States of America, 33.2 million cases have been confirmed and over 590,000 deaths. The COVID-19 pandemic continues to impact the Caribbean region with over 176,000 cases reported amongst the CARIFORUM member states and over 3,000 deaths reported. The pandemic is also impacting the organization of Eastern Caribbean states, and so when you look at the 9 OECS territories inclusive of Barbados, collectively over 12,700 cases have been reported, along with 180 deaths. Again, the COVID-19 vaccine is being rolled out in each of these OECS territories. In St. Kitts and Nevis, it's about 13 weeks now since we've been administering our AstraZeneca Oxford vaccine, and as at end of work day yesterday, over 23,340 vaccine doses have been administered, 17,579 in St. Kitts, 5,761 in Nevis. What does this really mean? So, ladies and gentlemen, as at yesterday, 51.6 or 52% of the target population has been covered with the first dose of this vaccine. And by extension, 19% of the target population is fully vaccinated. As I said before, in the Federation, we are now monitoring 19 active cases. This is the highest number of cases we've had at any one time since we started our response within the first quarter of 2020. We are working assiduously to contain this expanding cluster of COVID-19 cases. Please note the terminology, cluster of cases. At present, this describes the current transmission pattern in our federation. The Ministry of Health, we've been working throughout the day, 24/7 in terms of our contact tracing. This extensive exercise started last week, Wednesday, when we identified the first case in this most recent cluster. The aim is to identify, quarantine, and test all the possible contacts of this recent case, the recent cases. Now, I want to just pause here. Now, in terms of the contact tracing, we've been, we've touched and tested yesterday, up until yesterday, over 700 persons, and today alone, we will be testing over 200 persons. Now, the Ministry of Health team went to the Washington Archibald High School, we went to the Bastia High School, and the Seventh-day Adventist Primary School earlier today. As I speak, the Ministry of Health, or the Public Health team, is presently at the Tyrrell Williams Primary School. And so the recommendation for all the students who are being tested today is as follows. One, we are asking the students who were tested today to remain in self-quarantine. So only the students impacted today will be asked to self-quarantine. However, households, meaning the parents, guardians, and everyone in the household of these students, we are asking you to adhere to the COVID-19 prevention and control measures at all times. So this means the students in these schools, your household, you need to wear your face mask at all times during the waking moments of the day, and when you're interacting with each other, make sure you keep on your face mask, and hand sanitization is of critical importance at this time. And the purpose of this is, since the impacted child, was the first-year contact of the cases within the school system, we want you in the home setting to sanitize your hands before and after each physical encounter, and make sure you keep on your face mask throughout the day. So these are the recommendations for the schools that were impacted today. In essence, the virus is back. In other words, it has been reintroduced into the Federation. And so it's important for each of us to do what is necessary to protect ourselves from this virus. Now, the following 6 measures are ways in which you and I can protect ourselves from this virus and prevent the spread of this disease. 1, we are urging you to come forward and get vaccinated. Now, the vaccine is that one tool that we have in our possession to help to contain and combat this infection, or even this wave of infections. So we want you to empower yourselves with the facts about the benefits of this vaccine. Please note that it's safe, it's effective, in preventing moderate to severe disease. It's very effective in reducing your risk of transmitting this disease. So we want you to come on board and accept this vaccine. We urge you to adhere to the prevention and control measures. So ladies and gentlemen, once you step out of your home and you're in the public domain, we want you to keep your face mask on. And last night we got a number of questions regarding the proper way in which to utilize the face mask, and so it's well exhibited here. You must cover the nose and mouth. The face mask must adequately cover the nose and mouth. We want you to maintain good hand hygiene. So after you touch, after touching the high touch areas, doorknobs, countertops, you must sanitize your hands. Keep your hands out of your face, your nose, your eyes. And you need to maintain adequate physical distance from others when in public places. So if you're going to be taking public transport, you're going to go on the bus, you're going to go on the ferry, you must wear your face mask. The face mask must cover your nose and your mouth for the duration of your journey. Upon entering the bus, you sanitize your hands. When you jump off the bus or you come out of the ferry, you need to sanitize your hands. While or during your journey, keep your hands away from your face. This is very important because the person sitting next to you may just be carrying the virus. I need to mention funerals. Tomorrow I'm going to a funeral, and I want to recommend that you need to wear your face mask during the entire funeral service, while in the church and even at the cemetery. You must wear your face mask, keep it covering your nose and mouth for the entire duration of the service, while in the church and while at the cemetery. And make sure you maintain that 6 feet distance between yourself and the other attendees. If you are providing care to a loved one or a child, in this case, a child who may be attending the Washington Archibald High School, the Bastia High School, the Seventh-day Adventist Primary School, the Tyrrell Williams Primary School, the parents, I'm asking you to wear a face mask and even disposable gloves at all times while interacting with that child who may have been exposed to the virus. I want you to avoid crowds at this time. If you are experiencing any of the COVID-like symptoms, you need to remain at home. You must stay at home. However, you need to seek health care. So make a call to your regular primary care doctor or call the 311 hotline and seek advice regarding getting tested and getting medical care. And if you are experiencing any of the COVID symptoms, we are asking you to avoid taking public transport. You can, ask a relative or, a loved one to take you to the doctor or to the emergency room if that is what is required. If you are diagnosed with COVID-19, we want you to remain in isolation, and the reason for this is that we want to prevent the spread of the virus from yourself. If you are diagnosed, we want to prevent the spread of the virus to others who you would normally interact with. If you have been identified as a contact of a case, and if you are placed in quarantine, we are asking you to remain in place. Remain in the confines of your home if you're asked to self-quarantine, or if you're placed in a government or a COVID-19 certified facility, we are asking you to remain in the confines of that entity. Now, this surge in COVID-19 cases is a serious threat to our health system, and it's very important for us to adhere to the recommendations I just listed. Each of us, we have a part to play in terms of flattening the curve. Our aim is to keep the total number of confirmed cases at the lowest possible level. And in order for us to achieve this, we must continue this all-of-society approach. We need all hands on deck at this critical time. We are engaged in a warfare. It's a battle. We are fighting for our lives, and we want to use this opportunity to remind listeners about the AstraZeneca Oxford vaccine. It's the main tool that we have at this time in terms of fighting this virus. And we want you to come forward and get vaccinated. So the takeaway message this afternoon is to, if you have not already done so, come forward, get vaccinated. And also, you need to keep your face mask on at all times once you've left your house. And you have to sanitize your hands throughout the day and maintain adequate distance between yourself and others throughout the day. So those are the takeaway messages from this afternoon's presentation. Thank you.
Thank you very much, Dr. Laws. I now invite Superintendent Cromwell Henry to make a presentation on the new regulations.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. Now, this afternoon I'm going to spend some time going through aspects of the recent regulations. As we know that the Prime Minister would have made an announcement last night with respect to some restrictions on movements. And we know these announcements were public health measures aimed to control and prevent the spread of the coronavirus in the Federation. These measures are provided for and given legal effect by the Health Restriction of Movement Regulations, number 15 of 2021. And Regulation 3 states, a period of restriction of movement is imposed every day from 11 p.m. until 5 a.m. the following day, commencing on Tuesday, 25th May, 2021, and ending on Tuesday, 8th June, 2021. During this period of restriction of movement, every person shall remain confined to your place of residence, inclusive of your yard space, to avoid contact outside of your family, except essential workers who are required to report to work or for essential travel for medical emergencies. Essential workers would include members of the Royal St. Christopher Nevis Police Force, the St. Christopher Nevis Defence Force, the Fire and Rescue Services Department, the National Emergency Management Agency, and the Nevis Disaster Management Department, the National Emergency Operating Center, and the Health Emergency Operating Center, or any other disaster management services. The prisons, correctional facilities, or other similar establishments, any hospital, healthcare, or medical facility, the Customs Department, the Immigration Department, the Air and Seaports Authority, essential media personnel of a media house, the Office of the Director of Public Prosecutions, the Attorney General's Chamber, members of Parliament, and the Secretary to the Cabinet, and the government printery. All essential workers shall at all times carry identification and official work identification where possible. Persons who are not essential workers and you are required to move during this period of restriction, you must first obtain approval from the Commissioner of Police to do so. I repeat that, persons other than essential workers, which I just outlined, who are required to move from your home during this period of restricted movement, you shall first obtain approval from the Commissioner of Police to do so. And we have created a website, www.police.kn, where you could submit your application for approval to move. Businesses are required to close their operation at least 1 hour prior to the 11 p.m. restricted movement time. Ferries should make their last trips from either island by 9:30 p.m. I repeat that. Businesses are required to close their operations at least 1 hour prior to the 11 p.m. restricted closing time. So that businesses should be closed by 10 p.m. and ferries should make their last run from either island by 9:30 p.m. The regulation makes provision for penalties for persons who found in violation, and the person found violating these movement of restrictions shall be liable to a fine of $5,000 or not exceeding $5,000 or to a term of imprisonment. There were also some other restrictions that were announced, and these would fall under the COVID-19 Prevention and Control Order. And some of these restrictions are the restriction on public transport. All persons who are traveling on any motor omnibus or any hiring car or passenger ferry, you must at all times wear a mask. I repeat that, all persons who are traveling on any public transport, which include the passenger ferries, they must wear a mask at all times. All windows must remain open or partially open depending on the weather conditions. All persons shall practice good hand hygiene, proper sanitary behavior, and social distancing protocols. The driver, the master, or crew shall ensure that there is no more than 50% passenger capacity on board the vehicle or vessel. I repeat, the driver, the master, or crew shall ensure that there is no more than 50% passenger capacity on board the vehicle or vessel. And the driver, master, or crew shall ensure that sanitization of all doorknobs, handrests is undertaken after each trip. There is also some restrictions on sporting events, contact sports to be specific. No person shall attend sports training or practice sessions for amateur or other recreational sporting events. Of course, there is some exception that is made for the upcoming World Cup qualifier games scheduled for June 4th. Persons who contravene or fail to comply with the provisions of this order shall be liable to a fine not exceeding, again, $5,000. We remind the general public that these measures are public health measures designed to prevent the spread of the coronavirus, and so we anticipate your full cooperation in the adherence to these measures. The compliance team would be working very closely with the police and would be enforcing these measures. I've been asked questions time after time about tickets. I'm pleased to announce that we now have the ticket books on hand. They have been distributed, and so effective tomorrow, persons would be liable to be ticketed for any breach of these protocols that I've just outlined. If your passenger bus is carrying more than 50% passenger capacity, the driver would be liable to be ticketed. If the passengers are not wearing masks on the bus, the passengers would be liable to be ticketed. If you're not practicing social distancing, if you're not practicing the sanitization measures, then you'll be liable also to be ticketed. The fines ranges from $100 up to $500. And so we ask that persons avoid these fines. We have delayed the use of these tickets for quite a long time. It means that we do not want to use them. So just comply with the regulations and the protocols, and we will not have to use the tickets. Thank you.
Thank you, Superintendent Henry. I invite next Mr. Abdia Samuel, Chair of the National COVID-19 Task Force and our National Disaster Coordinator at NEMA, to make his presentation.
A pleasant good afternoon to all who are watching, and thank you, Mr. Williams, for your introduction. Today I just want to bring to the attention of the general public some of the containment measures to which we continue to support the Ministry of Health in containing this outbreak. I just want to read this excerpt, or let's say this presentation that was prepared by a committee and that we have put in place on the advice of both mitigation council chairs. This committee is a committee to support to support persons socially, meaning provide social support to persons who have been placed in quarantine. And this was drafted by the person who we have placed in charge of this committee, which is Permanent Secretary, Ms. Janelle Lewis, from the Ministry of Social and Community Development. Recognizing that persons and households would have been placed in quarantine without an opportunity to purchase or prepare sufficient food or other basic supplies, a decision has therefore been taken by the government to provide care packages for such families who are in need. These small but meaningful packages are geared towards ensuring that basic nutritional and health needs are met while remaining at their homes or hotel rooms during their quarantine period. A special committee chaired by the Ministry of Social Development and Gender Affairs has been established to primarily address needs assessment and distribution of care packages. Other members of this committee include representatives of the Ministry of Education, Transportation Subcommittee of the NEOC, and the Chamber of Industry and Commerce. A system has since been put in place to contact all households in quarantine to conduct a brief assessment of their medical need, psychosocial support needs, and required basic food supplies. This hard-working committee has also commenced outreach to various social and business partners to solicit support with hot meals for persons who are in quarantine at hotels and may not have access to kitchen facilities. We were undoubtedly encouraged with the overwhelming support received during the last year's lockdown periods. We take this golden opportunity to encourage all businesses, community-based organizations, churches, and individuals who are willing to donate towards this meaningful cause. If you are willing to do so, please do not hesitate to quickly contact the Permanent Secretary of the Ministry of Community Development and Gender Affairs, Janelle Lewis, at 662-5993. Allow me to repeat this number for you again, 662-5993, or the Ministry's Administrative Office number at 467-1020. Let me just further inform you that out of a list of 109 persons in quarantine, the list is bigger, 30 persons were contacted by social services today. So these persons were called via cell phones or whatever contact they would have had, and they were engaged. I must say to you that the persons who were contacted were welcome this initiative, and we already began to put the procurement list in place so that we can get these care packages to these individuals as soon as possible. I want to just reinforce what the previous presenters would have spoken about, but in particular, I want to address the issue of the compliance officers who are deployed to enforce the compliance, the protocols. I'm appealing to the general public, in particular those in public transport services, to comply with these officers. They are doing their best. You would have seen some of them at the ferry terminal or at the bus terminals. And my understanding from their reports is that there has been a favorable level of compliance and support and cooperation by these service providers. Let's continue to do so in the interest of curbing this particular outbreak. Persons in home quarantine, compliance officers have already begun to visit some of these individuals. When I say visit, let me make it abundantly clear that a roll call is being done from a safe distance. So it's not that they go into their houses and pull them out. These individuals are contacted via telephone or whatever means necessary, and then basically a roll call is done to ensure that individuals are at home. I must also report to you that we are satisfied and actually we are delighted to see the level of support we are receiving from the communities. The communities are doing their own policing. Once they recognize that individuals should be in quarantine, or they know, in particular family members, individuals are in quarantine, we are receiving the calls and we are responding immediately to these calls. So we want to continue to encourage the public support that we are getting from the general public in providing information to the task force, the Ministry of Health, and the police, and everyone else involved to ensure that we have full compliance with the regulations. However, as the chair of the National COVID-19 Task Force, I have been receiving a lot of complaints about children being on the road. We have had this discussion yesterday in the task force meeting with the Commissioner of Police, who has indicated graciously that he would engage the community policing team to ensure that they speak with the parents of these children and ensure that these children are monitored and are asked to stay at home. Dear parents, please encourage your children to stay at home during this critical time. I also want to use this opportunity to inform the general public that we are fast approaching the 2021 Atlantic hurricane season, and I am making an appeal for persons to begin to prepare. However, what is critical, you have to begin to prepare with this current outbreak in mind, that we might enter into a hurricane season whereby we may be dually impacted by two hazards, that being a cyclonic hazard and that being this particular pandemic. So make sure that when you are planning, you plan with that in mind, in particular when you're looking at sheltering. I want to commend, I had an opportunity today to visit some of the health centers and look at the vaccination program that is ongoing, and to see the numbers. Let us keep this momentum. I just want to encourage the persons who have voluntarily come out to vaccinate, continue. Let's sustain the momentum. Each one, encourage one. That's my best suggestion. That's my best encouragement to you. I am also appealing for patients with the 311 operators. Ladies and gentlemen, if you call once and you don't get through, please call again and again until you get the operators, and please have patience with the operators, as a lot of information is coming in and everybody is doing their best to facilitate as much as they can. I want to reassure the general public that we are doing everything in our powers to ensure that we do our best to suppress this particular outbreak as soon as possible. We want you to support our strategy, containment strategy that we told you that we want to implement. I want to commend today a meeting that we just came from with the High Command of the Police Force, which was chaired by the Commissioner of Police and attended by the St. Kitts Nevis Defense Force and also by the Customs and Excise Department. It was a very fruitful meeting where the strategies were outlined in terms of what we need to do to ensure maximum safety and security of you, the general public, and also for all essential workers who will be working at this time. So with that said, I want to reassure you again that we are doing our best, but we need to have all hands on deck. We need the all of society approach. This is not time for us to work in silos. This is not time for fake news. This is time for us to come together and support the mechanisms that are in place, and they are doing their work for your own best interest. So with that said, we will await your questions. Thank you, Mr. Williams.
Thank you, Mr. Samuel. Before I go into the questions, I want to make an announcement that I should have made last briefing. The group Band-Aid that has been very generous in giving packages to hotel and tourism workers who have been displaced because of the pandemic has decided that in light of the country being in the situation it is in now, that the group will not be making any more contributions unless the beneficiaries provide proof of vaccination. The members of the group will not compromise their health. Mr. Samuel, something?
Thank you, Mr. Williams. I just want to also read this bulletin board notice which came from the from the Department of Labor. So this will be read on behalf of the Labor Commissioner. In light of the current situation regarding the now 19, as reported today, 19 active cases of COVID-19 in our federation, the Department of Labor is appealing to all employers to be considerate and empathetic towards workers who have been ordered by the health authorities to enter quarantine. The Department of Labor asks that employers preserve the employment of the individuals so affected and, where possible, continue to pay wages, salaries in full or up to at least 35%, as quarantine workers may be able to claim sickness benefit in accordance with Schedule 8, Part 3, Section 9(2) of the Social Security Act. The Department of Labor also strongly encourages employers to insist that all staff members, workers, adhere to all of the COVID-19 safety protocols to reduce the spread of the virus. Let us continue to strive towards the maintenance of harmonious working relationship during this pandemic and put our best effort forward in working together to defeat COVID-19. So the question has been asked as well about from the employers regarding that, and Minister Phipps would have also I think his last briefing there about, she would have spoken about the letter that is being that will be drafted and signed, I think, by the Chief Medical Officer, which authenticates that individuals have been put into quarantine. So that is being introduced, and hopefully persons in quarantine will receive that letter. We are also looking into a certificate that authenticates that individuals have gone through the 14-day quarantine and they have been certified to reintegrate into society. A number of employees and employers have been asking about that. How do they verify, etc., etc. So we are trying to find a way to deal with that situation. So that is something that is being at the present moment brainstormed, so that it may be introduced to support our response to this critical to this outbreak.
Thank you, Mr. Samuel. We'll get straight into the questions. The first question is from the Observer newspaper. With the call for the public to vaccinate, are there enough vaccines to fully inoculate the target population? And are there enough to fully vaccinate the 23,000 plus who have already taken the first shot?
What I would like first to ask of the Observer newspaper is to, if you are, continue to encourage persons to step forward and get vaccinated so that the doses we have available, they can be used up. You have heard repeatedly that there is a shortage of vaccines on the global scale, and we were fortunate to have had over 40,000 doses available to us, and they should have been used up already. You've heard that the expiration date is the 30th of June, Dr. Lawrence?
Yes, 30th of June.
Yeah, 30th of June. Okay, and so let us focus on getting those used up. You've also heard that we are working behind the scenes to get other vaccines available, but there is no point in us having vaccines placed in a freezer here and dumping vaccines that are expired while people hesitate. And that's one of the reasons to why we keep saying, don't hesitate, do the right thing and get vaccinated. So I would like you, the caller from the Observer, to help us to make sure that we get those vaccines in arms.
Thank you, Dr. Wilkinson. The second question, for the students who were tested today, is the entire household to be quarantined or just the students?
Mr. Williams, as I said earlier in my presentation, the students at the Washington Archibald High School, the Barstow High School, the Seventh-day Adventist Primary School, and the Tyrrell Williams Primary, the students who were tested, only the students are expected to be in self-quarantine. However, the households are expected to adhere to the COVID-19 prevention and control measures. And the teachers who were tested today too, they are expected to also self-quarantine, just the teachers and only the students. But the households of these individuals are expected, we are recommending that they adhere to the COVID-19 prevention measures of wearing the face mask and using hand sanitizers before and after each physical interaction. Thank you.
This question is from Vaughan Radio in Nevis. Was case 47 tested upon entry into the Federation on May 9th? Could you explain the procedure once more? Are all inbound passengers tested upon entry, even though they provide documents to indicate that they are COVID negative, as well as on the 14th day of quarantine? Or is it just on the 14th day of quarantine?
Okay, so Mr. Williams, we have been guided by our health and travel protocols, which were completed as far back as the 31st of October 2020. So we've been guided by these health and travel protocols over the past 6 months. So all inbound passengers to the Federation, you go on our KNA travel form, you are supposed to complete the entry form and submit the results of an RT-PCR test done within 72 hours of travel. Upon arrival into the Federation, you submit this at the health station. You will be screened, and you're then dispatched from the airport to your hotel. Now, at your hotel, you are either in quarantine, confined to your room, or you vacation in place. And then at the end of your quarantine period, 14 days, you are tested. If you are negative, if your test returns negative, then you are officially released from quarantine and you can integrate into our society.
Thank you very much, Dr. Laws. Someone sent a comment, and there's a second part to it, a comment and a question. It's my opinion that naming the individuals infected will assist the contact tracing immensely, because I will know if I was in contact with Paul and able to come forward and assist the process. I will not be able to connect myself to a number. With that being said, question number 1. Can you give the rationale behind not naming individuals, in light that this is not a disgraceful virus, and we have seen sports figures, world leaders, and even royalty named without disgrace? And question 2, we have gotten the links between cases 46 to 54 and 61, but not links for cases 55 to 60. Please explain.
Thank you very much, Leswai. Well, first let me say that everyone is entitled to their own opinion, and so the person rightly said it is their opinion. But I just want to state some facts here. Every day we pass persons on the street and we don't know their names. Every day persons who travel on public transportation, they pass, they might sit next to them but they don't know their names. Every day you could go to offices and there's some persons who you know, there's some persons who you don't know. But the reason why we tell you in this pandemic you need to wear a mask, you need to social distance, and you need to sanitize is that you need to assume that everyone is positive. And by assuming that everyone is positive, you can decrease the spread of the virus if you happen to go in contact with anyone who had the virus. And so there's absolutely no reason why one needs to know the 15 or 16 persons who happen to have been confirmed to have COVID-19. We have already said that you may have confirmed cases, but there might be some persons who are not confirmed, and so you need to assume that everyone has the virus. You said that the virus is not a disgraceful virus. The virus is a deadly virus, and it is because it is deadly why we ask you to do those things. I can also tell you too that the persons who do the contact tracing, etc., they have sufficient information when they come in to interview the persons who would have been confirmed to do the necessary contact tracing without putting the person's name out there in the public for the public to come and give us information. And you were asking about cases 40-something, etc. I think what all we need to know now is that the virus is back. We have persons here who are positive, and you need to do what is necessary to contain the virus. And so your personal and individual responsibility is what you need to do in terms of decreasing the spread. But you don't necessarily have to know the details of these persons, because what is happening, persons are beginning to victimize persons, and it is not a scorn. And we can help to decrease the scorn by keeping the person's information out of the general public.
This question is for the Chief Medical Officer. It was indicated that the interval between the first and second dose of the AstraZeneca vaccine has been reduced to 4 to 5 weeks in light of the vaccine expiring. The World Health Organization's website states that delaying the second dose up to 12 weeks gives a better immune boost. In light of this, what is the level range of efficacy if taken at 4 weeks? Also, is there any known increased risk from taking the 2 doses of the vaccine 4 to 5 weeks apart?
Very good question, Mr. Williams, and I want to use this opportunity to commend those individuals who came on board very early in terms of empowering themselves about the facts regarding the benefits of this vaccine, and they accepted this vaccine very early on in February and March, and so we were able to give them 8 to 10 weeks appointments. At that time, when we got the vaccines, we also told the public that the shelf life of the vaccines is short. Yeah? So I'll begin by saying that. I also want to add and underscore that the manufacturers of the AstraZeneca Oxford vaccine states emphatically that the vaccine, it's a 2-dose, it has a 2-dose regimen, and that the interval between the 2 doses can be 1 month to 12 weeks. So that's 1 month up to 3 months. So you can give dose 1, and then 1 month interval, you can give dose 2. You can give the first dose, and then 3 months, the second dose. So that's the range with which we can operate, within which we can operate. And most of the trials regarding the AstraZeneca Oxford vaccine were done whereby the participants or the recipients, they were given the 2 doses with a 1 month interval. And so I also want to add that the efficacy is as high as 76%.
And I just want to underscore what Dr. Laws has just said, because we keep getting asked this question repeatedly. Yes, there was some benefit in persons coming forward early and receiving the vaccine, because we know that after the first dose, the efficacy is 76%. And the studies have shown that the further away, up to 10 to 12 weeks after the first dose, the efficacy can rise to about 82.3%. But the vaccine can be given as early as 4 weeks after the first dose. And so, yes, the efficacy, getting it after getting it after 4 weeks might not be as high as 82.4 or 83%, but even getting 1 dose is better than getting none at all. And so time is of an essence. We say in a pandemic, time wasted can result in lives lost, but if one can go forward and get a dose of the AstraZeneca vaccine now, even if at the end you have to wait for another batch before you get your second dose, I would suggest that you do that. But you have to understand that we are adjusting the schedule to accommodate the latecomers, but to make sure that they have a sufficient level of protection so that if the virus attacks them, we know that they would have a 100% chance of not dying from the vaccine, from the virus.
The CMO's response read children who have been tested being in quarantine, but not the rest of the family, does not sit well with many in our community. A number of employers and supervisors are expressing discomfort with these other family members being at work. What measure of comfort can the CMO give these persons? Also, how can one guarantee that the rest of the family will abide by rigid COVID-19 measures and not be careless and compromise others in the workplace and the public, thereby adding to the number of cases and infection rate.
What I can say, which I've said many times before, is that we are going to have to learn to live with COVID-19 until it is eradicated. And the way it's going to be eradicated is through mass vaccination. And until it is eradicated, you can protect yourself to some degree with the prescription of non-pharmaceuticals that we have been speaking about. And I also said that you need to assume that everyone is positive. And if you assume that everyone is positive and you wear your mask the proper way that you're supposed to wear it, over your mouth and your nose, if you hand sanitize regularly, if you try and maintain the social distance or physical distance at all times, if you avoid mass gatherings, you can pass someone who happened to be positive and be certain that you will not get COVID-19.
Another concern that was expressed, there is a growing concern that the domestic setup in most families does not allow the child to be in a room of its own, most of the time with separate bathroom facilities. Okay. These questions are from Win FM. I think that question was answered before in terms of the period with the vaccines and but I would ask this. Was there an update from the manufacturers in this regard in terms of the reduced time with the vaccine? How safe is this? Have the possible effects of altering, reducing the timeline and any associated risks been verified? What is the purpose for the change in the timeline?
All right, so Mr. Williams, very good question. There isn't a change. The manufacturers from the onset, from when we got the first batch, February the 11th, the insert or the fine print said that you could give the vaccine 1 month between dose 1 and dose 2 with an interval of 1 month, or you can give it an interval of 3 months. So that's the range within which you can administer the 2 doses, and that's from the outset. So there isn't a change. The reason why we are utilizing a shorter interval, it's because of the shelf life of the vaccines, and we've said that repeatedly.
There's a question for the task force. There is a document being circulated purporting to be from St. Christopher Air and Seaports Authority, indicating that persons visiting the ports must be either vaccinated, I suppose fully vaccinated, or possess a negative PCR test. Is this true? And if so, does this also apply to the ferry terminal? Attorney General.
Good afternoon. This document was brought to the attention of the government, and I would say that it had been inadvertently published. At this point in time, the Cabinet has given no such consideration or decision. And so we would want to say that until such time as the Cabinet has issued or supported such a decision, we would hope that this document would be disregarded at this time. Thank you.
There's another question. There are a lot of questions surrounding the whole issue of parents and children, because that is where we're at, and the anxiety, I suppose, that if parents of children tested today, living in the same household, are to be in quarantine for the next 14 days.
All right, so Mr. Williams, in the presentation I said that the students tested today, they are to self-quarantine for the 2-week duration, and we are asking the households to adhere to the prevention and control measures. Now, I want us to all recognize that COVID is unprecedented. It's like never before. We have never had to go through this before. And so we are craving the understanding of the parents and the guardians at this time. And we are not asking anything that's not possible. Can I share? My daughter had to care for someone who was diagnosed with COVID, and for a 2-week period, provide care for the individual, and she was able to do that without becoming infected. So the prevention and control measures work. Yeah, and so that's why we are asking the household members to adhere to the prevention and control measures. You can live in a house with somebody who may have been exposed. So your child is not diagnosed with COVID. So the exercise today is one of contact tracing. Your child was exposed to a positive case, so your child is being tested and being monitored just in case the child picked up the infection. All right, so there's no certainty as yet. So we are asking the parents and the guardians to understand. Just put steps in place in the house to prevent any exposure within that setting. And all that is required is to wear a face mask at all times. Hand sanitization is critical. Wash your hands before and after all physical interactions. Just, make that special effort. Wear that face mask, hand sanitization, and you're good to go.
I just want to repeat something that I said last night also on Leadership Matters, in that we may be able to contain this cluster and move forward, but the virus will keep coming, and we will have other clusters again. And the way you can prepare yourself and learn from this one is to go out and get vaccinated, because we've said repeatedly the reason why adults have to get vaccinated is so that they can protect those who cannot be vaccinated. They can protect their children. And so if we get to this safely, the next case that comes in, I would hope that every parent who has a school child, they will go and get vaccinated. I will hope that every teacher will be vaccinated, so that those precious persons in our federation who are the future of this country, they would have a protective shield around them, so we would not have to be dealing with this problem once more again. And so the message we have to keep repeating is go out and get vaccinated, because that is our best tool in fighting in this pandemic.
We want to thank everybody for your questions, and I want to thank Dr. Laws and Dr. Wilkinson for making it absolutely clear that over the last year and up to this point, the medical team, the chief medical officer, who is our chief technical medical person in our country, have been consistent and very clear on their advice. Each of us individually has a personal responsibility to protect ourselves, those around us, whether it be our children, the elderly, our families, and the community at large. There have been non-pharmaceutical measures that they have insisted upon, and you hear them here today again. We all must wear the mask and wear it properly. Cover your nose, cover your mouth. We have heard from Superintendent Henry here today that the compliance teams, the police, will now insist that we do so, and if we do not do so, we'll be forced to start issuing tickets so that we can learn that behavior properly. We must sanitize, wash our hands, clean surfaces properly. But the final tool that we have got is that we vaccinate. We are not mandating anybody vaccinate. We have encouraged and urged. And we are very, very happy to say that some 52% of our target population has gotten there. We are getting there. But we encourage you to do so quickly, because there's only a limited number of vaccine doses available. We hope that we'll have all to cover everybody, but we can't put off much longer. We are happy that you are vaccinated. We're getting there, but please do so to protect yourself, your family, and everyone in our society. We're in this thing together, and if everybody protects it, as Dr. Wilkinson has said, and says so repeatedly, we'll be able to deal with it. I'm a layman, but I understand the message very clearly. I am fully vaccinated, but it's possible that I might get the COVID. But I am confident that if I do so, I won't get seriously sick. I do not expect, if I get sick, to reach the ICU or even die, because the level of risk is so low, having been fully vaccinated, that as a lay individual, I feel that I'm protected. And if enough of us do so, we will have fought and won the battle against COVID. That is what is meant by population immunity, herd immunity. Most of us must have that vaccination. And so, the more we delay, the longer we stay to get to that point where we can live with it. Just as those before had with polio and other types of viruses that were deadly and dangerous to us. Vaccination corrected a lot of that. And we can only urge and encourage all of us to take the vaccination and do so quickly. Thank you very much.
That brings us to the end of our question and answer for today. However, I would like to say that the governments of CARICOM are making the argument that there must be vaccine equity and that the richer countries that have an abundance of vaccines ought to share those vaccines with countries that are less rich. However, if persons are not taking the vaccine, then it undermines that argument that is basically being made. Because nobody would want to give vaccines when those vaccines are not being used. And that is just a fact. I want to thank all of you for asking your questions today. Of course, we can go on, and all questions cannot be asked and answered in one press briefing, but we'll attempt to go through the questions, some of them, there are a few left, and ask them at the next press briefing. I want to thank Dr. Laws for really answering the questions with a lot of grace, and it has not been easy for her as the Chief Medical Officer. And she has to answer questions repeatedly and say the very same things over and over and over again in terms of what we must do to adhere to the protocols. They have not changed. People are asking, sending questions and asking, oh, what protocols is put in place at the hotels and so on. But it's the same protocols. It's the same protocols at the hotels that people must really adhere to. The protocols have not changed. So some of those questions are eliciting the very same response over and over again, like a broken record, really. So I want to thank her very much for answering the questions today. And like also Dr. Cameron Wilkinson, our Medical Chief of Staff. I thank the Attorney General, who is Chair of the Disaster Mitigation Council, the Co-Chair of the Disaster Mitigation Council, the Honorable Wendy Phipps, Superintendent Cromwell Henry, for explaining the regulations, and Mr. Abdias Samuel, Chair of the COVID-19 Task Force, Mrs. Christmas Jacobs for her service of sign language, and all of us here at the NEOC, Vesta, we thank ZIZ, and all the media for their questions, because they are partnering with us in this fight against the COVID-19 virus. Thank you very much, and we will see you next week, Wednesday, at the very same time. I am Les Roy Williams.
is on.